Up next, things seem fine 1 minute, then all of a sudden you start to panic, your heart is racing, you break out in a sweat, and you can't explain why. A possible solution to panic and anxiety disorders when we come back. Welcome back, everybody. 40 million adults in America suffer from anxiety and panic attacks every year. Many doctors prescribe anti-anxiety and other medications to address the problem. But Dr. Stephen Hotze says instead of treating the symptom, we should get rid of the cause. Welcome back, the author of Hormones, Health, and Happiness and the founder of the Hotze Health and Wellness Center.
Thank you, Deborah.
I have friends who suffer from these panic attacks, and they feel like they're having a heart attack. They feel like they can't breathe. We know that Earl Campbell was another person who had suffered greatly from those. But there are times when you can explain the panic. If you're in a car accident, for example, and you get behind the wheel of a car. We're talking about this vast number of people who suffer from panic and anxiety, and they really can't explain to you why.
Right. Well, that anxiety, it's an intense, unexpected sense of uneasiness or even fear for no apparent reason whatsoever. And they'll break out in a sweat, they'll feel like they can't swallow, they have something in their throat, their heart will race, they may have a regular rhythm, can't sleep, and they just, at night, and it overtakes them.
Yeah.
And then it will suddenly resolve. But if this commonly occurs in women, say from the age about 30 till the age about 50, as a woman marches through her menstrual life, every cycle she has to rebalance her hormones. Her hormones have to balance. And we know that the hormones that both men and women make play an important and a significant role in the way we think, in the way we feel in our body. They don't just affect our sex organs, our sex glands, or secondary sex characteristics. They affect our thought processes because they affect the production of neurotransmitters. So when they get out of balance, for instance, as a woman marches through her life, her progesterone levels, that's the hormone of the last half of the menstrual cycle, will decline. And her estrogen, although it declines to a degree, doesn't decline as much as progesterone, and it's a very estrogen is a very hyperactive hormone. It's a stimulatory hormone, and it causes the production of changes in the neurochemistry in the brain. And so women, as they go right before their period, they'll have estrogen dominance, and they'll get these symptoms 2, 3, or 4 days before their period. It often is cyclical in nature, these anxiety attacks, but it's a decline in hormone. So what do doctors do for this? Well, oftentimes women will go to the doctor and he'll go, well, you know, it's all in your head. And so they end up getting anti-anxiety medication like Xanax, or they'll put them on antidepressant medication, which those in themselves can have some significant and serious side effects.
Yeah, but and that's addressing the symptoms.
That masks the symptoms. And those drugs, by the way, can be very addictive as well. It's very hard to get off of them, and they can cause some significant mental distortions when you take those.
So the answer is, you feel, and what do you do to figure out whether it truly is hormonal?
Well, it's fairly simple. Besides the anxiety, women will often come in with the symptoms of the fatigue. They don't think clearly. They complain of brain fog. They have insomnia, joint muscle aches and pains.
So it's a collection of symptoms.
Yeah, it's a collection of symptoms, and they're often cyclical. So it says, like, for 5 or 6 or 10 days before I have my period, this is the way I feel, and then it goes away. Well, it's hormones then, right?
Yeah. And
oftentimes a woman will come in and tell the doctor, I think I've got my hormones aren't balanced. And go, what makes you think your hormones are balanced? Because they tell the symptoms.
Right.
And oftentimes, particularly male doctors don't tend to be as sympathetic as female doctors because they have never experienced it personally. Although they may have experienced it in their loved ones.
Yeah. Is that how you got into this business, Dr.
The worst thing you can tell a woman is, do you think it's your hormones? I've found out one time, you can say that one time. After that, you never say that again. But in fact, women will often tell you, when they tell me they're having these problems, say, what do you think's causing the problems? And they'll say, I think it's my hormones. And I say, I think you're right.
Yeah.
So why don't we try to replenish and rebalance the hormones? So as we age, our hormone levels decline. Simple concept is, why don't we replenish your body with the same identical hormones that your body used to make in adequate amounts and optimal amounts? That's kind of a novel idea. So we just fill the tank.
It sounds like simple medicine.
It's simple. It's straightforward. Everybody ought to do it. So you simply replenish the progesterone, and on day 15 through 28 of the cycle, and that has a huge and powerful impact. It can also be thyroid levels as they fall can cause the same problems, and they usually work together in combination. Women's hormone levels fall, their female hormones will decline. Their thyroid hormones don't work as effectively when the female hormones are imbalanced. So if you balance those out and add a little bit of thyroid, it can solve a host of problems. It really can.
It seems like to me it's just in recent years that we started hearing so much about hormones, yet hormones rule just about every function in the body. Why is that? And how much time did you spend on hormones in medical school?
Not much. Most of the, when we do OB-GYN, you take a biochemistry course the first year, and the physiology course, and then you go out and you learn how to give drugs or do surgery. But I harken back when I started to treat women and men in midlife. I went back and read the biochemistry books and the physiology books to figure out how the hormones really worked and if that could be causing the problems or not. And sure enough, it was the problem. But the drug companies, remember, can't patent what occurs in nature, so they have to come up with some kind of alternative treatment that they can make money at, and that's usually a chemical, a drug that's never existed before in nature. And to me, it doesn't make sense to think I can create something that never existed before in nature to treat a problem caused by, not working properly, my natural hormones not working properly. Why don't we just do something natural? So this is a more natural approach. It's safer and more effective than taking a bunch of drugs, which are toxic. And, they have all kinds of interactions. We know from the recent death of Michael Jackson that may have played a role, some interaction of drugs. And this happens all the time. As a matter of fact, every year, 100,000 people die in America every year from interaction of drugs. Prescribed drugs. So drugs are not something that should be
sometimes we need them. You got to admit, sometimes we need them.
Can
but
be,
you feel like they're being overprescribed.
Well, absolutely. When you have 100,000 people die every year of drug interactions, that's a significant problem that's not being addressed.
All right, Dr. Hotze, thank you very much. You can catch Dr. Hotze on his radio show called Health and Wellness Solutions. It's weekdays on 700 a.m. from noon to 1. It's a live call-in show with experts on health and wellness. If you want more information on Dr. Hotze, you can call the Hotze Health and Wellness Center at 281-698-8698. 281-698-8698. You can also go to hotzehwc.com. Thank you very much.
Thank you so much, Deborah.
Coming up.